From WFRV TV, Local 5, serving Northeast Wisconsin, including Green Bay, Fox Cities, and the Lakeshore. This is Newsmaker Sunday.
Good morning and welcome to Newsmaker Sunday. I'm Tom Zalaski. Something happened to our kids during COVID, and we didn't see it until now. A just released survey has some disturbing findings about our kids and what they think about themselves, their thoughts on things like suicide, harming themselves, along with their feelings of anxiety and depression. And joining me this morning to talk about the findings, Sheng Yang, the executive director of an Appleton-based organization called Us Too Behavioral Healthcare. Sheng, good to have you this morning. Thanks so much for being here.
Thank you for having me. It's great to be here.
Much appreciated. Before we get into the particulars of the survey that was taken, a little bit about Us Too Behavioral Healthcare. What does your organization do?
Yes, so we are a nonprofit really focusing on behavioral health, health equity. Our mission is really to close that gap on health disparities with a mission, right, that our whole community can be healthier together.
You have in your mission statement, you put heavy emphasis, as you just kind of mentioned here, on treating and counseling patients with their particular cultures as your guide. What unique issues do your clients face when requiring treatment with culture in mind?
Yes, so we look at every individual holistically, really focusing on culture. And I think when folks maybe read that on a website or on the net, they may think that we have a heavy emphasis on people of color or folks from different ethnicities, which partially true. Yep. But culture means a lot of different things. We could look at age, we could look at different generations, right? So looking at culture and how people identify themselves versus what society assumes or believes that person to be.
Yeah. How long has Us Too been in operation in Appleton?
Yes, we were established and opened doors September 2019, I'm sorry. So a couple of months before COVID-19. Started the organization with just my husband and my partner and I, and now we are about 21 FTEs. Yeah,
what do you have for staff?
We are primarily made up of clinical therapists or clinicians, and so we have an outpatient team, so they provide services to anybody in the community at the office, and then we also have a heavy emphasis on school-based mental health counseling as well.
Okay, and you're a nonprofit. How are you funded?
Yes, most of our dollars really come from grants and donations, and then also from commercial plans. A lot of times, when patients come to us and they have a commercial plans with their deductibles, and we even have a sliding scale for those who maybe prefer to be self-pay or don't have the option for commercial insurance.
The genesis of Us Too, how did it all start? Who had the idea? What did you see out there that there was a need you had to fill?
Yes, so my background, I'm a licensed clinical social worker by trade. I've been practicing both in government and public sectors for the last 15 years or so. I think the biggest gap that I saw was that healthcare, or our healthcare industry, was looking at a one-size-fits-all. And based on my practice experience, that was not the case at all. And so what happened was we were not able to serve a large amount of folks in our community based on this one-size-fits-all, right? My partner, my husband, he has a business background, and so we kind of put both of our minds together, and this is where we are now, where we are able to really grow the business, right? Grow the nonprofit. I think our success and our growth really speaks testament to what the community needed.
You touched briefly on your past, a little bit more detail. How did you get to where you are today? What was your path out of, say, college?
Well, out of college, I worked for a government entity. I started really working with crisis units and working with individuals who had what we would call a severe persistent mental illness. So schizophrenia, psychotic disorders. Along the ways, I started working with law enforcement in crisis intervention, supporting individuals who were going through either suicidal or homicidal ideations, and going through the judicial process for that on a civil commitment. From there, I went on to manage a large psychiatric hospital, and then really found myself to enjoy teaching future generations. And so for 5 years, I was a professor with the University of Wisconsin-Green Bay, teaching in their social work program. In the meantime, I was also running US2 Behavioral Healthcare, and finally hung up my hat as a professor with UW Green Bay this past August because US2 Behavioral Healthcare has really just grown.
Right.
So I needed to give that all of my attention.
And I take it what you are doing today was something that probably was not needed some 30 years ago.
Absolutely not.
Yeah.
At least we didn't have that awareness.
Right, whole different world. When we come back, the survey and what we found out about our kids and what COVID did to them. Stay with us. We are back now with Sheng Yang, the executive director of US2 Behavioral Healthcare, an organization behind a study that essentially says our kids are not coping all that well in post-pandemic life. Where, Sheng, was the survey conducted in general?
Yeah, so this was a survey that's done yearly or annually by the Wisconsin DPI. All of this information is public knowledge. It is on the Wisconsin DPI website. It's under the what we call the YRBS, which is the youth risk screening tool that's administered to our youth.
And this year's study, was there a time frame? When did you do the study?
Yes, so I did not do the study.
Right, not you, but
right,
DPI.
Yes. So the latest study and data that we have out right now is from 2021. What happens annually is the school districts administers the survey, and then they send it to DPI, and then they analyze all of the data and they give the report out. So it takes a very long time, right, as we can tell with research and data and analyzing.
And how many kids were involved in this? Was it all kids?
Yes, yep, youth.
Youth, how many? How many?
In the one that I looked at particularly, there was about 1,300 students.
Okay, and in that 1,300, you talked earlier about cultures, and you had mentioned based upon age and some other factors, but I take it this one wouldn't be so much age. What cultures were we talking about here?
Yes, so we're talking about populations really focusing on Northeast Wisconsin, or particularly the Fox cities, right? And so cultures that we often see here are going to be our students of color. We're looking at, the poverty, the culture of poverty, low socioeconomic status, and then also our LGBTQ students.
Okay, and although the study was taken in the Fox cities in general, the results, would we be safe to assume that it would hold true for the rest of the state, for kids in other parts of Wisconsin?
Yes, I think when we look at the Fox Cities results and we compare it to statewide results, the margins and the numbers aren't very far from one another, right? And so that's good, right? Because, with us being in the Fox Cities, we at least at minimal want to be, similar trends as the state as a whole.
Yeah. Big number that jumped out on me. We're going to get to the survey here. Big number jumped out. 40% of those surveyed, these kids said they don't belong here. What did they mean, I don't belong here?
Yeah, that's a big question, right?
Yeah.
The question about I don't belong here is a newer question as part of the YRBS is what I'm finding. And when students or when folks are saying, our kids are saying, I don't belong here, what they're saying is they're questioning their existence or trying to find a place for them, right, or for themselves. And if we look at that 40% and then we compare it to the students who are scoring high on depression, self-harm, and anxiety, it makes sense, right? If a student and our youth are not feeling like they belong and they don't feel as though there's space for them here in their environment, that's of course going to lead into, hopelessness, worthlessness, anxiety, depression, right? And perhaps even thoughts of self-harm.
Yeah, did that surprise you that kids felt they didn't belong? Or did you expect that?
Yeah, I knew that we had an uptick nationally. We've seen this data that there's an uptick in youth mental health. What really alarmed me was the rate of kids who said they don't belong, right? When we look at diagnostic and mental health symptoms, sure, someone may experience brief episodes, right, of, depression or anxiety, but I think, when we have kids in our youth saying, I don't belong, we're almost escalating that to another level.
Are they okay as far as belonging? Are they okay with belonging here in Northeast Wisconsin where they live?
The data doesn't specify exactly what they mean.
Okay. Couple of findings that stuck out, particularly disturbing. 8% of those surveyed had attempted suicide in the past 3 months. You said there were 1,300 kids in this survey. So that's more than 100 kids who've attempted suicide in the past 3 months. Did that surprise you?
Very alarming.
Shocked me.
It did.
Yeah.
Yes, and when we look at just Wisconsin as a whole, right, in terms of youth accessing, utilizing crisis services, and then also youth suicide rates, those trends, have kind of stayed either consistent or trended up a little bit. The biggest concern with the alarming number of students or youth who are saying they attempted suicide is, I'm curious to know how. Especially with our culture, right? We talk about culture. Our culture here in Wisconsin with hunting and access to firearms, because we know here in Wisconsin overall, firearms is the #1 way of how most people die by suicide.
I'm asking you to get inside their heads. Any indication why they're attempting suicide?
There's no indication based on the research. I have my anecdotal thoughts about why we have an uptick just in general with mental health, especially youth mental health.
Yeah.
I think a large part of it does have to do with COVID-19. When we think about the impact of COVID-19 on us, we essentially were forced to move into a crisis mode, right? Our whole infrastructure and life as we knew it was wiped from us within minutes. And when our whole infrastructure is taken from us and we're operating in a crisis mode, it takes our brains a little bit to kind of return to the normal way of functioning. Yeah. The problem with COVID is that it was prolonged. Right? It was 1 or 2 weeks as we initially thought. It was, a couple of weeks, then a couple of months, and then we found ourselves in a couple of years. And because we kept waiting for answers, because nobody really knew, right? And it's by no means anyone's fault, but because we operated as a system and a society in a crisis mode, that in turn puts people's mental health in a bad spot, because we're creating or we're experiencing this anxiety about what's next then. What is my life going to be like tomorrow or next week? What is the structure that I'm familiar with going to look like? What will happen to me? Yeah.
Another number that goes along with the suicides, the attempted suicides, 11% have considered suicide. They didn't attempt it. But that's got to be concerning, because now we've got the 11% plus the last figure of those who actually did attempt. You've got almost 20% of these 1,300 kids who have either attempted or thought about it.
Yes, almost a quarter of them.
We are back with more with Sheng Yang right after this at Our Kids. Stay with us. Back now with Sheng Yang, the Executive Director of Us Too Mental Health Care. We have been talking about a survey concerning our kids and their attitudes following the COVID pandemic. Next statistic, Sheng, 17% of those surveyed engaged in self-harm. Let me ask you first, do you know what the self-harm was? Like, what do these kids do?
Yes, self-harm can present very differently. It could be anything from cutting themselves with a knife or a pair of scissors to burning. Self-harm could even be, banging our heads or hurting or injuring ourselves in for the purposes really of because of our mental health and trying to cope with what we're experiencing in our minds, right?
So why? And here again, I'm asking you to go into their heads. Why are they doing this? I mean, is it a cry for help, to get attention? What's going on there?
That certainly could be one of the reasons. I would caution us to steer away from saying, it's a cry for attention, because even if it's a cry for attention, right, that child or that youth or that individual is missing a need in their life, right?
Yeah.
And so when we look at self-harm behaviors, really it's a coping skill. It's a coping skill that is maladaptive to whatever the person is experiencing internally. And it's not a healthy coping skill, but it's still a coping skill, because for some individuals, they may be engaging in that self-harm but they have no intention or thoughts of, suicide or hurting themselves beyond, let's say, like cutting or burning. And so our role really as clinicians in society is to say, okay, that's how you've learned how to cope with your mental health symptoms, let's say. How about we try to replace that with healthier coping skills?
Interesting. You say coping skills and not to get attention.
Yes.
That's surprising. Survey also said 25% of your survey participants meet the criteria of major depression.
Yes.
What's the criteria? What are the signs?
Yes, so when we look at the criteria for major depression, we look at the timeline, right? Is it episodic or has it been going on for at least 2 weeks, right? So that's the bare minimum. Other questions that we need to take into consideration is, thoughts of hopelessness, right? Worthlessness, episodes of crying, but even irritability, anger, particularly when we look at youth and children. Their depressive symptoms look very different than mine and yours as adults because we have the vocabulary, right, to maybe articulate a little bit better. And so with youth mental health particularly, we might see a little bit more aggression or irritability, anger. We might see a lot of truancy or missed absences from school. And we take all of those pieces and say, okay, does everything that's going on in this person's life, including their mental health symptoms, does that meet the diagnostic criteria for major depression or depression in general?
Along that same line, 45%, according to the study, have the criteria for general anxiety disorder. How is that displayed?
Yes. So we all, as human beings, we all experience anxiety and stress, right? Between different parts of our lives. Sometimes it's positive stress and, it's human nature. When we look at generalized anxiety disorder, we're looking at whether the student, that youth, or that individual's anxiety is severe and significant enough, though, that it's impacting their functioning, right? It's impacting their quality of life, and is it pathological in nature? And so that's kind of a medical term that I'm tapping into. But sometimes we might say, okay, I'm having a little bit of anxiety. Yes, again, we're humans. Of course we do. We all experience anxiety at some point in our lives. But we want to look at, the symptoms and then impact of quality of life and interfering, right, with that student or that individual's purpose. So, for students, they need to be going to school, right? They need to have structure in their lives. They need to be having social relationships. But if the student is so impaired or anxious and they're not doing these things, then that's when it becomes pathological.
And now that you've seen the numbers, have you come to any conclusions? Does it change the way that you treat these people? It
definitely does. I'm a large, I pay a lot of attention to research and data because I think it's in front of us and we have to realize how widespread it is, right? When we look at these numbers, even if it could be skewed by a couple of margins or points, it's still significantly high.
We are back to wrap up right after this, so please stay right there. And welcome back. We are back now with Sheng Yang, the Executive Director of the Appleton-based US2 Mental Health Center. And we've been going over results of a survey done on 1,300 young people, giving us some indication of how they are or are not coping with post-COVID. The results of the survey, can parents see the results? Where can they see it?
So typically what happens is DPI will release the data to the different school districts, and every school district really does different things with it depending on their policies and procedures. So I'm certainly not sure if parents are aware of this data. I know that many school districts do administer a mental health and a suicide risk assessment to all of their students in the district. And that data is, if the student is scoring high for different risks, then the parents are contacted. So that's a separate data tool or set, but in terms of the ones that you and I are referencing, I'm not sure if parents are aware.
Okay, if I am aware, I'm a parent, I'm concerned, I want to broach the subject with my child. But how do I do that without directly asking, have you tried to commit suicide?
Yeah.
Are you thinking about suicide? Are you anxious? How do you approach your kid?
Yes, I think we have to look at age group, right? Are we looking at a 10-year-old, a 12-year-old to a 16-year-old? That is what I would consider or encourage all of us as parents to consider first. But the other piece too is, as parents, we are responsible for addressing the elephant in the room.
Right.
Right. We are responsible for what happens in our homes, right? And at some point there needs to be a separation of school and home. And if the school is telling us this data, we have to take that information and do something with this. So if you're concerned about your child, ask. If you're concerned about how your child may take that information, or you're really just unsure on how to approach it, there's mental health clinicians out there. There's organizations out there that can maybe help you, maybe tailor that conversation a little bit. The same survey and data that you and I are talking about, one of the biggest protective factors for students and youth is having somebody to talk to.
Sure.
Right?
Yeah.
That's the biggest protective factor, and it's even more of a protective factor when that person is an adult that can help them navigate through life. And so perhaps you are that adult.
Got about 30 seconds here, Shang. You're looking for money from the City of Appleton American Rescue Funds.
Yes.
How else can people help?
They can call us and make a donation, or call us and make a donation right on our website. We have a donate button. All of our dollars through donations and grants go right back into the agency to really support individuals who can't fund or pay for their services.
Shang Yang, thanks so much. Frightening, fascinating. Thank you so much for being here.
Thank you for having me.
If you have a newsmaker in your town who you think that we ought to have on this program, let us know about it. Send us an email to tips@wearegreenbay.com, or you can message us on Facebook. And be sure to join us once again Sunday morning at 7:30. Until then, have a great day.